Well, another federal budget is done and dusted, and there's several implications for the physiotherapy profession which I wanted to talk through with you today. Obviously at a top line level there's been an overt focus on small business, and this will obviously affect the more than 5,000 small businesses in the physiotherapy industry around the country. A reduction in the corporate tax rate, as well as accelerated depreciation or straight line depreciation of capital items up to $20,000 are some of the initiatives to support small business that were announced in this budget, and I think that will give physiotherapy clinics the opportunity to reinvest in capital and infrastructure, possibly in IT, but also in clinical equipment and innovation. So I think that's net a good outcome for physiotherapy. Obviously the announcements around MBS reform are also relevant, where Health Minister Susan Ley has announced several different MBS reviews, one of which is a detailed and long-term process to review every item funded under the MBS, but also the formation of a primary care advisory group to give advice on the way in which care is funded to support people with chronic and complex disease in Australia. And certainly the APA welcomes that process and hopes to be a part of the conversation around that review. Also some relevant announcements around e-health, continued investment in developing what is formerly known as the personally controlled electronic health record. And whilst it would be good for the health system to have this up and going, I guess we're just a little bit wary that a substantial investment has already occurred. Whilst there's been patchy penetration of this tool, that what it means for allied health practices is as yet uncertain. In terms of research, some very good news with the announcement of, or the formalisation of the previous announcement that the Future Fund for Medical Research will be established with an aim to get $40 billion into that fund over the coming years. Certainly that presents an opportunity for physios to continue to make the pitch for their role in research, particularly around musculoskeletal disorders, spinal cord injury, and many other areas of physiotherapy practice that have previously been the recipients of research funding. Also some positive announcements regarding Indigenous health, some reinstatement of funding programs that were ceased in the previous year's budget. So overall, I think as far as the physiotherapy profession is concerned, there's always some tensions around what will happen at a state level as health budgets are announced through the jurisdictions. But the support of small businesses is certainly something that the physiotherapy profession welcomes. So in summary, I think a budget that's good for small business is good for physiotherapy practices in the community. Always going to be some caution around what happens in a state budget level with regard to health services that affects our members working in the public sector, but certainly a cause for optimism for physiotherapy in the private sector. So again, thanks very much for your ongoing support of the advocacy work that the APA is performing, and I look forward to seeing you soon.